English through Health Topics. Welcome to English through Health Topics, your gateway to medical English excellence. Welcome to our channel where health meets language learning. We're here to help you master medical English through real conversations between doctors and patients. Whether you're a healthcare professional, student, or simply someone who wants to understand medical terminology better, our channel provides authentic dialogues that will boost your confidence in medical communication. Today's health topic: the effects of sugar elimination on your body. Why this topic matters. Sugar consumption has become one of the most significant health challenges of our time. Many people consume excessive amounts of sugar daily without realizing the profound impact it has on their bodies. Understanding what happens when you eliminate sugar can help you make informed decisions about your diet and overall health. This consultation explores the remarkable changes that occur in your body when you stop eating sugar for just 14 days. What you'll learn: how sugar affects your appetite and cravings, the connection between sugar and chronic fatigue, why eliminating sugar leads to rapid weight loss, how sugar impacts your mood and brain function, the relationship between sugar and inflammation, long-term benefits for your organs and overall health, learning support. Don't worry if some medical terms sound complicated. At the end of this dialogue, we'll provide a complete vocabulary breakdown with simple explanations, pronunciation guides, and example sentences to help you understand every medical term used in the conversation. This will make it easy for you to learn and remember important health vocabulary while improving your English skills. Now, let's begin our conversation. Doctor-patient consultation: sugar elimination effects.
Good morning, John. Please have a seat. How have you been feeling since we discussed eliminating sugar from your diet 2 weeks ago?
Good morning, Doctor. Well, I have to say I'm quite surprised by the changes I've experienced. I actually followed through and completely cut out sugar for the full 14 days.
That's excellent commitment. Tell me, what specific changes have you noticed in your body during this period?
The most surprising thing is that I've lost my appetite for sugar completely. I used to crave sweets constantly, but now I don't even think about them. Is that normal?
Absolutely normal, John. When you consume sugar regularly, it causes fluctuations in your blood glucose levels. Your pancreas releases insulin to manage these spikes, which often leads to hypoglycemia. That's when your blood sugar drops too low. This hypoglycemic state triggers intense sugar cravings. By eliminating sugar, you've stabilized your blood glucose, breaking this vicious cycle.
That makes sense. I've also noticed I'm much less hungry throughout the day. Before, I felt like I was constantly snacking.
This is directly related to what we call insulin resistance. When you consume excessive sugar over time, your cells become resistant to insulin, the hormone that helps glucose enter your cells for energy. Your body starts rejecting the sugar because it recognizes it as toxic. When your cells can't properly utilize glucose, you feel hungry even though you're eating. Now that you've eliminated sugar, your insulin sensitivity is improving, allowing your cells to be properly nourished.
I see. Another thing, I used to feel extremely fatigued after meals, especially lunch. That post-meal tiredness has completely disappeared.
That's what we call postprandial fatigue, tiredness after eating. When you consume high-sugar meals, your blood glucose spikes dramatically, which actually makes your brain sluggish. Now that you're maintaining stable blood sugar levels, your brain can function optimally throughout the day.
The weight loss has been dramatic too. I lost about 12 pounds in the first week alone. My clothes are much looser, especially around my midsection.
That initial rapid weight loss was primarily fluid retention being released. High sugar intake causes your body to retain excessive water. The abdominal area, or what we call visceral fat accumulation, is particularly responsive to sugar reduction. Your waist circumference is actually one of the best indicators of metabolic health.
My mood has improved significantly as well. My family says I'm much calmer and more pleasant to be around. I can concentrate better at work too.
Sugar consumption creates inflammation throughout your body, including in your brain. This neuroinflammation can cause mood swings, irritability, and cognitive dysfunction, problems with focus and attention. By eliminating sugar, you've reduced this inflammation, allowing your brain to function more efficiently.
Even my skin looks better. I had persistent acne issues and they've cleared up considerably.
That's because high insulin levels trigger the production of androgens, male hormones that increase sebaceous gland activity, leading to acne formation. In males, elevated insulin actually suppresses testosterone production, which can cause various hormonal imbalances.
I've also noticed less joint stiffness in the mornings. Is that related?
Definitely. Sugar consumption promotes systemic inflammation throughout your body. This inflammatory response affects your joints, muscles, and connective tissues. By eliminating sugar, you've significantly reduced this inflammatory burden.
So what's actually happening in my body during these 2 weeks?
Your body is undergoing metabolic adaptation. Instead of using glucose as your primary fuel source, your cells are developing the enzymatic machinery to burn fat efficiently. This process is called ketogenesis. Your liver produces ketones from fat breakdown. Ketones are actually a superior fuel source for your brain and can promote neurogenesis, the growth of new brain cells.
What about my liver and kidneys? I know I had some concerns about fatty liver disease.
Excellent question. Excess sugar consumption leads to hepatic steatosis, fatty liver disease. When you eliminate sugar, your liver begins mobilizing these stored fat deposits for energy, essentially cleaning itself. Additionally, chronic hyperglycemia, high blood sugar, is particularly damaging to your kidneys' nephrons, the filtering units. By stabilizing your blood glucose, you're protecting your renal function.
This has been easier than I expected. Should I continue this approach?
Based on your results and how well you're tolerating it, I'd recommend continuing with minimal sugar intake. Remember, this metabolic transition typically takes about 72 hours to complete. You may have experienced some initial symptoms during those first 3 days as your body adapted.
I did feel a bit sluggish initially, but it passed quickly.
That's normal during the metabolic transition. Supporting your body with B-complex vitamins and adequate potassium can minimize these adaptation symptoms. The key is that you've successfully converted your metabolism from glucose-dependent to fat-adapted, which has tremendous long-term health benefits.
Thank you, doctor. This has been incredibly educational and encouraging.
You're very welcome, John. Continue monitoring how you feel, and let's reschedule a follow-up in another month to assess your continued progress.
Medical vocabulary made simple. Don't worry. We'll explain every medical word in the easiest way possible. Let's break it down. Sugar and blood-related words. Hypoglycemia. Hypoglycemia. Simple meaning, when your blood sugar gets too low. Think of it like your body's low battery warning. In the talk, this causes sugar cravings when your blood sugar drops. Blood glucose. Blood glucose. Simple meaning, the sugar in your blood that gives you energy. Think of it like fuel for your body's engine. In the talk, we need to keep your blood sugar stable. Insulin resistance, insulin resistance. Simple meaning. When your body stops listening to insulin, the sugar control hormone. Think of it like a door that won't open even with the right key. In the talk, your cells are blocking insulin because too much sugar is harmful. Brain and mood words. Cognitive dysfunction. Cognitive dysfunction. Simple meaning. Problems with thinking, remembering, or focusing. Think of it like when your brain feels foggy or slow. In the talk, you couldn't concentrate well before eliminating sugar. Neuroinflammation. Neuroinflammation. Simple meaning. Swelling and irritation in your brain. Think of it like your brain feeling puffy and not working well. In the talk, sugar causes brain inflammation that makes you moody. Postprandial fatigue. Postprandial fatigue. Simple meaning. Feeling very tired after eating. Think of it like a food coma that makes you want to sleep. In the talk, you used to feel sleepy after lunch every day. Body and organs words. Systemic inflammation. Systemic inflammation. Simple meaning, swelling and pain throughout your whole body. Think of it like your entire body feeling sore and achy. In the talk, sugar causes inflammation everywhere in your body. Visceral fat. Visceral fat. Simple meaning, dangerous fat around your belly organs. Think of it like fat that wraps around your liver, heart, and other organs. In the talk, your waist size shows how much harmful belly fat you have. Hepatic steatosis. Hepatic steatosis. Simple meaning, fatty liver disease. Too much fat in your liver. Think of it like your liver getting clogged with fat. In the talk, eliminating sugar helps clean out your fatty liver. Renal function. Renal function. Simple meaning, how well your kidneys work to clean your blood. Think of it like your body's natural water filter system. In the talk, high sugar damages your kidney's ability to filter properly. Body process words. Metabolic adaptation. Metabolic adaptation. Simple meaning, your body learning to use a different type of fuel. Think of it like switching your car from gasoline to electric power. In the talk, your body is learning to burn fat instead of sugar. Ketogenesis. Ketogenesis. Simple meaning, your body making ketones, special fuel from fat. Think of it like your body's backup power system when sugar runs out. In the talk, your liver makes ketones to feed your brain. Insulin sensitivity. Insulin sensitivity. Simple meaning, how well your body responds to insulin. Think of it like how easily a door opens when you use the key. In the talk, better insulin sensitivity means your cells can use energy properly. Hormone words. Androgens. Androgens. Simple meaning, male hormones, like testosterone. Think of it like chemical messengers that control masculine features. In the talk, high insulin increases male hormones, causing acne in women. Sebaceous glands. Sebaceous glands. Simple meaning, oil-making glands in your skin. Think of it like tiny oil factories under your skin. In the talk, these glands make too much oil when hormones are unbalanced. Quick reference. Most important terms. How to use this table. This table shows the 5 most important medical words from our conversation. Each word has 3 parts to help you learn. Column 1. The medical word doctors use. Column 2. What it means in simple English. Column 3. A memory trick to help you remember it. Study tip. Cover. Column 2. Read the medical word, then try to remember the simple meaning. Medical word. Simple meaning. Remember this Hypoglycemia, low blood sugar. Hypo, 'cause low, like hypodermic. Insulin resistance, body ignoring insulin, like ignoring a stop sign. Inflammation, body. Swelling, irritation, like a cut that's red and swollen. Visceral fat, dangerous, belly fat, fat around your organs. Metabolic, how your body uses energy, your body's engine system. Why these words matter for your health. Understanding these terms helps you talk to doctors more confidently, understand medical advice better, make informed health decisions, recognize symptoms in your own body, explain health problems to others. Great job learning these medical terms. You're now ready to understand health conversations like a pro star. Thank you for watching English Through Health Topics. Please like this video if it helped you learn something new. And don't forget to subscribe for more medical English conversations that will enhance your healthcare communication skills. Hit the notification bell so you never miss our latest health vocabulary lessons.